Hello, and welcome to the weekly philosophy chat. My name is Claire Foster, and I'm joined today by Dotan Russo.
Hi, Claire. Good to be here.
Hi, Dotan. Thanks for joining me. So, today we're going to be talking about MAID, which is an acronym that stands for Medical Assistance in Dying. Now, MAID is a hugely controversial subject around the world right now. Why? Because it forces us to think about the value of our lives and the value of others' lives. Now, Dota and I were just going back and forth a moment ago and preparing for this. MAID as an acronym can refer to many things, and it very much depends on where you are in the world. So it's worth noting that we will make every effort to be clear about what we're referring to. But in certain countries, MAID is an umbrella term for both euthanasia, which is physician assisted dying, as well as self-administered dying as well. In other countries, those two are distinguished. So we will do our best, but it's worth mentioning that footnote as we have this conversation. So let's jump right in. Dotan, would you like to take a first pass at this idea that this subject in general, really, unlike almost any other, gets to the core of how we feel about the value of life and whether there are conditions to that assignment of value?
Yes, definitely. It is a practical question, but also very much philosophical question, religious question. So many aspects are involved in one position or influence one's position regarding this topic. But I think maybe first it would be better to clarify the concept or what are we actually referring to, because each category may be addressed differently. So first of all, the main one that we're considering is active euthanasia, where someone is actually being administered with a poison of certain kind that ends his life. A different kind is a passive one, passive euthanasia, when a person is in a situation where it can be easily or not easily be managed. For example, it requires to be connected to the oxygen machine, and we just avoid from passively, we avoid from providing him with what he needs to save his life. There's a voluntary euthanasia where the person himself give his own consent, and we can get a direct impression and idea of what he wants. There are non-voluntary situations where the person himself either is not capable to provide with such approval. He's in a very late stage of dementia, or there was earlier approval when he was capable, but now when this question becomes more crucial and more immediate, we cannot get his answer. So first of all, there are different kinds. And it's important to differentiate between them because the position that one holds regarding each one may be different.
Yep, that makes sense. Thanks for clarifying that. So then to jump into some examples. So in Canada, we certainly see a slightly more liberal version of what's acceptable in terms of when and how one can end his or her own life than we do see in the United States, where the conditions are much more stringent and euthanasia, as in physician-assisted suicide, is illegal across all 50 states. So I'd love to talk about so that this really gets again to how we think about the value of our own lives, particularly if we're faced with a terminal condition, but even if we're not. What is the option, this option that some countries offer? Does that somehow implicitly suggest that there is less of a value to one's life if we know when it will end, or that the remainder of one's life would be less healthy than another's? Does this suggest some sort of something implicit that we need to be paying attention to?
I think we we would likely find a correlation between certain characteristics of a certain society and its tendency to approve euthanasia slash MAID. In very conservative countries, very religious countries, it is much less likely. In countries which identify themselves as more liberal, the probability of this is higher. Overall, there are 195 states, recognized states in the world. Very few of them, relatively, legalized euthanasia. You mentioned Canada. Even in Canada, it's a relatively new thing. It was approved, or it was became legal in 2016, so just 10 years ago. And there are certain criteria that we might touch soon that are set to make sure, as much as possible, that those cases that would be approved would be the right ones. But Canada, in that sense, cannot be directly identified as a secular country or religious, and also there are different provinces in Canada, 10 altogether. Each one of them has may have a different characteristics, or some differences, or some nuances, and yet this law is a federal one. It applies to all states together. And what's important maybe to realize in this context is that once it became legal, the people have spoken, in a sense, because in 2016, when the first year it was legalized, there were 1,016 people who went through euthanasia. At the year 2020, it became 7,600, and in the year 2024, it became 16,000. Now, just to get an idea of the scale in terms of proportion, 5.1% of the death in Canada in 2024 were by euthanasia, which means that 1 to 20 of the death cases were people who went through this process, which is a huge number, right? I would never imagine such a proportion in just 10 years, and the numbers keep on climbing. So what we may take from this is that once this became available, people find it as a very applicable and desired, right? As much as we can use this term, way to end their lives. And many people, in fact, go through this process. So in Canada, it's quite clear that there's a great demand for this, which may speak volume to in regards to how the Canadian sees this.
Yeah, I see a lot of concerns with this. I saw that same statistic, which was blew my mind as well. But I'm worried from an ethical standpoint about the normalization that this suggests. That 5% of deaths in an entire very large country are attributed to this. That is coming along the lines of being a normal way to end one's life. Now, I happen to be personally a proponent of bodily autonomy. I actually do support this. I do support one's individual decision to end their life if that's what they so choose. But I can't help but see some problems with just the sheer number, and that leading to a feeling of normalization, not only within one's own mindset, but also within the medical profession. That if a doctor, for example, sees a patient that is maybe has a year to live or is suffering undue harm from X, Y, or Z, or is at an advanced age, if not, though is perhaps expected to recover, that person could be offered MAID, and when that person may have several more chapters of their lives to live. So I see some problematic elements from the normalization, as well as just the role of the medical profession in general, which has vowed to do no harm and to help extend life. And so then where does that leave doctors who are trying to do right by their patients, but also perhaps at the same time consider that maybe ending life is the more peaceful, the more merciful outcome.
As you point out, obviously there are many challenges regarding this topic, and this is why most countries in the world, most societies do not take this direction. Relatively very few do, and even those who do, like Canada, it's a very recent development.
Mm.
And you mentioned a few concerns that, and to be fair, I think, because we started by emphasizing the fact that Canadians do express their need in this process. There are, of course, many concerns and many objections, religious ones, right? You know that most people, there are 8 billion people in the world, the most of them identify themselves as religious, as in that way or the other. And if you're religious, especially in accordance to the monotheistic religion, then it's almost a clear cut that euthanasia is not should not be permitted because God gives us life, and God is the only one who's authorized to take life from this. So this would contradict your very central beliefs, which may even suggest that this is a sin, a great sin. So that is one objection. There are other objections, as you suggested, that the state role is to provide with healthcare and not to encourage in any way death. Maybe it would also serve as an easy way out instead of investment in possible research and cure. You know, there's a relatively easy way out. The person can just end his life. There's a potential or a concern of manipulation and pressure being put on certain people, especially older, elderly people who are in a condition of need. You know, that they may get the impression either directly or indirectly by their family or by the people who are close to them that they are dependent on, that this is maybe a solution that they should choose. And if that is the case, they may actually request euthanasia, not because this is truly what they want, but as an outcome of this pressure. You also mentioned the slippery slope, and I think the numbers talk for themselves in this regard. But at the end of the day, what are we actually talking about? We talk about people who are suffer tremendously. They choose to go through euthanasia. The process itself is not an easy one. It requires two assessments of, in Canada at least, of physicians or nurses. If it's not, if the death is not imminent and is expected to arrive in a very short time, then there's a period of 90 days at least, which is required until euthanasia is being practiced. So there's time for them to consider the process itself. The day of the euthanasia, they're of course being provided with all the information and they're being asked again. We should assume that in the vast majority of cases, hopefully in all cases, this is a true and authentic consent. This is the will of the person. Now, you know, philosophically speaking, we don't choose to be born. We are being thrown to this world. As far as we know, we don't choose. We don't have a say over this. And one would argue that the ultimate sense of liberty, one's liberty, is to decide whether he wants to continue living or not. And if the person himself or herself decide that her life is not worth living, due to constant unbearable pain or other conditions, humiliating conditions of dependency and others, I think that we as a society have an obligation to respect this will of the person. And not only this, I also think that we should provide them with means, the best possible means to end their lives, because one may wish to die. And yet, I find it very difficult to actually exercise this. Because, you know, theoretically speaking, one may argue, okay, you want to end your life, do it yourself. Why should we take part in this, either by euthanasia or MAID, by providing you with you know, the poison or whatever is needed? But in truth, suicide is not an easy thing to do, right? It requires, first of all, a lot of courage. It requires access to certain elements, right? Unless you jump from a building, and that is a very hard thing to do. You can never be 100% sure that you will actually end your life. You might end up injured, severely injured, which is even worse than this. There are even aesthetical considerations, right? You kill yourself, someone's going to find you. So you hang yourself or shoot yourself at home. You know, all those things things, when you think about it, as a neutral person, it seems to be like a real alternative. But if someone is truly facing this dilemma, it's far from being so. And the chances, if someone goes through euthanasia through a suicide act, then this may be the completely opposite of mercy and good death. That's the meaning of euthanasia, right? It's a Greek word which means good death. And euthanasia provides those people with the guarantee that at least the final moments, the death would be a good one. And under such circumstances, I strongly believe that this is the right choice.
Yeah. No, you make great points, although I will challenge on one thing that I'm just looking at my notes right now, that according to a report that I read, that the reasons for engaging and applying for MAID tend not to be associated with a pain threshold, but more existential in nature. That loss of autonomy, 80 to 90%. Loss, obviously there's overlapping categories here. Loss of engagement, 80+%. Loss of dignity, 60 to 70%. That you're a burden, 40 to 60%. And this goes on. And so what this tells me is that perhaps society is not doing a good enough job in valuing one's life, even at a final stage, even when they're in pain, even when the nature of their life has changed, and that perhaps socioeconomic factors play a role in that many feel that being a burden to their family who can't afford their ongoing care is worse than their own hastened death, which to me is obviously very sad, especially when there are more potential chapters to live. Experiencing a pain threshold one can't tolerate is a different matter, but for existential reasons, particularly for those that are related to socioeconomic factors, to me, this signals that we should be doing something else, something better within our society.
I agree that if there are ways to improve the lives of those who consider euthanasia due to their certain circumstances that can be improved, and that is obviously not always the case, right? If
Right.
someone is suffer from ASL, if I'm not
ALS, yes.
ALS, sorry,
Yeah.
ALS, then the trajectory is very dark, and it's a fact, right? There are different stages, but eventually, if the person would live long enough, he will end up in a very bad condition, and this is not something, at least now, that can be fixed. Also, we should remember that people live today live much longer. Life expectancy grew, so while people live longer, the quality of their life not necessarily aligns with this, right? So
Hmm.
people get to very old age, but not in a good condition. But I think, in a sense, yes, I perfectly agree with you that society should put the main focus and the first focus on improving the conditions as much as possible that led to a desire of one's to end his life. But I think we should also recognize that both that there are many cases that is not possible, and secondly, even if it is possible, it's possible more in theory than in practice because ideally in an ideal world, people would be provided with all their needs. In the real world, this would never happen. So people are just living certain life circumstances as a matter of fact, not as a theoretical discussion, right? And they are waking up in the morning for in their life circumstances, right? And at the end of the day, if they choose to end their lives, then I think that we should respect this, as long as, of course, as we sure that this is a free consent, as much as we can be, and this is the true desire of the person. And you know, just in this context, there are many people who do not find their life as valuable, even regardless of harsh conditions. And this is again a philosophical question: to what degree other people has the right to intervene with one's with the way one sees his own or value his own life. There are about 15,000 people who commit suicide in the US alone every year, which is about 120 something for a day, about 5 point something for an hour. every hour in the United States alone. Most of them, many of them, do not suffer from tremendous illness. They just don't find, of course, there are many unfortunate cases that should be prevented, but there are many who truly do not value their life, even if they don't suffer from a certain disease. And my view on this is, which I accept that is not, is not trivial, far from it, that at the end of the day, this should be left to the person himself to decide whether his life is worth living or not. And society should make sure to put the limits or to put the barriers so that we will be left only with those who truly wants to end their life, maybe for justifiable reasons. But once we get there, we reach this conclusion, we should provide them with the ability to end their life in a peaceful death, with a peaceful death.
So, would you say that a young person who's suffering from mental illness, who has a long life to live and potentially many happy chapters within the condition that they suffer from, should be approved for MAID in Canada? Because that's something that's very much on the table right now.
More than on the table. It's supposed to become legal on March 2027. There were a few delays already. Maybe there will be another delay, but the legislation already took place. So it's not a theoretical question in Canada. This is obviously much more complicated. There are categorically two ways to look at it. One is to assume that mental illness is very different in principle. Categorically, it's very different than physical illness. And I think many of us tend to accept this because of a variety of reasons. One of them is that when someone suffers from a physical pain and he's losing his weight, and it's very noticeable, we can relate to it much stronger than a person who suffers from depression. Seems to be exactly like me and you. Function, he looks fine, that he has even, he can smile and laugh in certain hours. It's very hard for us to truly identify with the true condition of someone who suffers from severe depression. Luckily, I've never experienced this, but from what I've been learning, for a severe depression can be experienced as painful, as difficult to handle as the most physical pain. So, first of all, we need to acknowledge this, right? What are we actually referring to? What is actually this mental situation? Now, I also agree, of course, that the mental condition is something that is much more likely to be treated and maybe even to be improved. Although there are cases where nothing works for many
Yes, that's
years.
true.
That is a fact, right? And so this is a much more problematic question because we want to make sure that we do not provide one with means to end his life, while in truth, there was no good reason, even from his own perspective, if we just give him enough time to consider this or to experience the changes, then we don't want, obviously, we're not interested in this. But categorically speaking, or in principle, the question would be, should we accept that mental illness, in principle, in radical situations, should also be considered for euthanasia or not? That is the crucial question, right? Before you discuss the specific criteria, as who's involved in the process, and so on. And in principle, I would say that I'm not necessarily against this as well, because this goes back again to one's basic freedom to decide whether his life is valuable enough or not. And sometimes, even just last one comment regarding
No,
this,
no.
sometimes even if the condition is curable, the pain is so unbearable that the person is just not willing to go through this, even if he's being promised, or there's some likelihood that eventually he will get better. And
Yeah.
that is also something that we should take into consideration. If I was saying to someone, I'm giving a very radical example, or providing him with the option to go through tremendous torture, while also saying to him that eventually this will end after 6 months, a year, 2 years of unbearable torture. But you will recover from this. You will get out of this torture chamber. Some people would say it doesn't worth it for me. The pain is so hard, it's so unbearable that I'm just not willing to go through with this. And life as a whole, even if I go out of depression, doesn't justify this.
I think it's just a very slippery slope in terms of what kind of mental condition would qualify, would justify the end of life. Because you could make the argument, sure, there are certainly many cases of treatment resistant depression, to use your example. And that's true. And I think from what I've read, that is a physical form of pain as much as it is a mental illness as well. But then I mean, just as you said, you can't measure it. You can't take a blood test for this. This is self-reported. So how do you argue against or for a condition that might not be as serious as treatment-resistant depression, if I can use the word serious, but also impacts the person's life in a really in a way that limits their ability to live a full, otherwise normal life. How do you define where you draw the line there? And I just worry that if MAID would be opened up to mental illness in general, how does one even define that? I mean, is anxiety mental illness? Anxiety can be very debilitating, but are we telling people who suffer from true and deep and almost measurable anxiety that life might not be worth living and that society, neighborhoods, doctors can't provide or won't necessarily need to provide you with the support that you would need in order to live a full life, even with this condition of anxiety? I worry about how one even goes about defining this, and I worry about the message that sends in this inevitable slippery slope of mental illness.
I think you're raising two main concerns. One, although you didn't use this term, some skepticism about this whole um, mental science, right? Who's to tell? How can we judge, right? If someone suffers from cancer, we can check his cells in the laboratory and identify the stage.
Yeah.
This is not, it's not the same about mental illness. Uh, there's a question and there's a debate, I think, legitimate debate among even professionals regarding to what degree psychiatry is a science like other areas. You know, in some ways, psychiatry is scientific, right? There's some certain observations that can be taken on the brain activity, certain areas of the brain. Now, of course, you're right. Depression is a subjective experience that, at the end of the day, related to to the conscious, and we don't have direct access to it, and therefore we cannot truly evaluate what is the true objective condition. So that is one concern. The second concern that you mentioned is the slippery slope. But let me ask you this, as a principle, in principle, as a philosophical question: why is it so crucial for us as outsiders to to provide a judgment, right, or to supervise the judgment of someone else, assuming it's an authentic will, right? Of course, I'm putting aside any situations where
Coercion.
there are any, yes.
Yeah.
Why should we consider our judgment or our position regarding one's own value of his own life? Why shouldn't we accept that if an individual does not find his own life to be valuable enough, right, for serious reasons, of course, right, to recognize serious reasons, why shouldn't this be enough?
So I do again happen to fully agree with the theoretical concept of bodily autonomy. And I do believe that if someone wants to end their life, again, outside of the terms of coercion, for what reasons you may have, that is within their right. And that's not my job. That's not my life. That's not my work to tell someone else how they should live or end their life. I do believe that. But what worries me is that when it becomes a policy within a country that you live in, that story is told to others that life is not valuable under certain conditions. So there is a distinction there. So I respect what individuals want to do, but when it becomes a policy, I have grave concerns because for someone who has severe anxiety, to use that example again, you're not going to die from your anxiety, but you do need to live with it the rest of your life. And it could possibly be painful and it could affect how you live your life and your happiness, but you won't die from it. And I have trouble with policy that supports the narrative that death could be a solution for you. I would much rather see a country or policies developed that say, we recognize how hard it is to live with mental and physical pain in the early stages of your life, the middle stages of your life, late stages of your life. And these are the things that we're going to do to be sure that you have as much of happiness, contentment as is humanly possible within the confines of your physical life. That's how I would reconcile those two.
But the question, what makes one reach a certain conclusion, position, a certain state of mind, is a very complicated one. We are all influenced by culture, by norms, by
Yeah.
beliefs, by, so many things. At the end of the day, this all sums up to one's specific conscious and specific, output. If you analyze or become skeptical about the legitimacy of one's decision regarding his own self based on, the possible influences, then where do you draw the line, right? A person can suffer from cancer and decide not to get any treatment. Right? This would means that he will die, and maybe there's a relatively easy treatment with great chances to survive this. And there are people that would say, "I'm not going through chemo. I'm not going through any treatment. I choose otherwise." We could do the same. We could assume that there are all sorts of influences, right? And possibly that is indeed the case, where this person, unlike the others, is actually going through directly to his own death, while this can be saved. Even one with a broken arm, right, can get to the hospital and say, I don't want this to be fixed. One can decide to live as a homeless under very severe conditions, in the Canadian cold. So where do you draw the line regarding this? There's something possibly one may argue, and of course, it's not a personal criticism, just as in the context of a philosophical conversation. This is a kind of a patronistic view that allows us as observers, outside observers, to judge whether one's position is truly justified or maybe not truly justified, because it is an outcome of all sorts of influences that we
Mhm.
do not consider to be valuable enough. Now, euthanasia is not a policy, of course, right? You use this term. It's not a policy. It's a service which is being given to people who voluntarily ask for it, go through a certain process, which is relatively demanding in the sense that, to make sure that this is a true, justified case. And it involves all sorts of, stages that I think cannot be described as a policy, but rather more as a service which is being given, right? And again, at the end of the day, you leave those people who wish to end their life with very miserable options. The numbers that I provided you about suicide scale in the US alone tells you that eventually people who wish to end their lives, many of them eventually end their life, but they are forced to go through much, much worse conditions. They're taking much higher risks. In many cases, they end up miserably. The trauma for the family and the other members can be much worse, right? Finding someone who hanged himself in the living room, and so on and so on, right?
Yeah.
And I think the fundamental question at the end of the day, because there are different layers that we can discuss, and we do discuss, right, as you mentioned, is to what degree a person has the right to decide that he doesn't want to live anymore. And I
Yeah.
believe that we should be very, as a society, we in principle, of course, making sure that we take out the wrong cases and the wrong the clear ones, or the ones that are signs for this. But once it is clear that this is one's wish, We should, in the right circumstances, we should provide them with this much better alternative of euthanasia, which is a good death by definition.
Yeah, yeah. Well, I think that um, pretty much sums it up. I think we do agree on multiple fronts, and we might be a little bit going off on slightly on other points, but in general, I think we do agree that one has the right to choose the conditions under which they end their life. I know that's not necessarily a popular position with everyone who will be listening to this, but that's okay. We encourage comments and discussion about that. And also, we encourage everyone to pay attention to what's going on in the news and use your voice if you have a different opinion. That's how change happens, right? So, Dotan, thank you so much for joining me today and for this great, important conversation.
Thank you, Claire.